Alex, thank you very much for joining me today. It's a pleasure to have you here.
It's a pleasure to be here. Always good to talk to you.
Yeah, for those who don't know, Alex Cahana is a very interesting person. One could say blockchain enthusiast, a big blockchain believer. And today's episode would be, I think, a very interesting conversation. Alex, I wanted to ask you first. You are advocating for blockchain and you have a slightly different approach to it. You view it more as a technology, as means to achieve a better quality of life, better outcomes for people that are using and adopting this technology. However, the media, the previous crashes associated with the crypto world, sort of like brought this worse narrative for the technology. Can you please talk a little bit about what is the current narrative of crypto, given that AI took over with regards to headlines, anyways, and what's wrong with it, and how do we change that narrative in the context of shifting the thinking and viewing it as a technology rather than means to make money?
Yeah. Well, that is the question. So, we can have I can give you a whole hour answer, but we'll try and break it down. I want to say that a lot of the narrative around blockchain and cryptocurrencies is around the technology, the what, the how, the when, and it's a very transactional narrative. And we have never really stopped for a second to talk about the why.
Mm-hmm.
Why was this conceived? Why did Satoshi, back in 2008, use blockchain for the first time as a protocol for Bitcoin? And so, because of that lack of pausing for a second and trying to understand the why, we went into this rat race of a very transactional narrative that's all about, okay, what's the prices of these currencies? Am I making money? Am I losing money? And I got that eerie sense when the first time I went into a bookstore and I saw a blockchain book in the technology section. And then a couple of months later, I saw it in the business section.
Mm-hmm.
And as I was kind of diving deep into this and trying to understand the why, I would say, wow, this needs actually to be in the social studies or even the philosophy section. And I think that in essence, it's not so much blockchain, but the block change is really the decentralization, the action of community, of swarm intelligence, of using shared databases. That is the core behind it. And I think that if I would have to summarize in one sentence what is blockchain, I wouldn't use public ledger or whatever, because I don't even know what the word ledger meant. It reminds me of you're too young to remember, but it was a Name of a Rose. It was a movie with Sean Connery. We have like monks writing, on a ledger and touching with a pen their tongue and they're
Mm-hmm.
dying. It's like I would say that uh, 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 blockchain is the software solution to the social problem of trust. And that what we're living now is through a time of trust and mistrust, misinformation, which has eroded our ability to collaborate, to coordinate, to cooperate. And that is the essence of the, I want to say, reality that we live through, be it geopolitical, be it economic, be it healthcare, whatever. And that's why I'm so enthusiastic about it. That's why I truly believe that in a way it forces us to work together, especially those who do not want to work together. That's my,
Mm-hmm.
my kind of feeling of blockchain.
One could say, because we are a health tech centric podcast, why does blockchain has to do anything with healthcare? Alex, you are no stranger to healthcare, and you understand the system in and out. How do you think this concept of decentralization and bringing back the trust aspect, especially when it comes to data sharing, especially when it comes to data about payments, which is often very vague, so to speak. How do you view blockchain helping solving these crucial problems for the U.S. healthcare?
Well, I'm glad you said at the end U.S. healthcare, because U.S. healthcare is an outlier of different other forms of healthcare. Healthcare in emerging markets and developing economies, what I like to call lean economies, is very different than high income countries and very different than Europe, Japan, Singapore. And I want to say that specifically for the healthcare industry in the United States, there are many stakeholders, and those stakeholders don't trust each other. And so, if we agree for a second that blockchain is the software solution uh, for the problem of mistrust, then we can go
Mm-hmm.
over the technology of why it actually solves it. I would say that healthcare is the industry vertical that is most amenable to be disruptive. Because in essence, the healthcare in the US is extremely centralized. It
Mm-hmm.
represents 20% of our GDP. And each stakeholders are just in mergers and acquisitions. Payers are getting bigger and bigger. Electronic health records is an oligopoly of 4 or 5 vendors that are capturing 80% of the market. There is, I want to say, this way of doing things in the United States where private corporations are contracted to work with the government. They actually manipulate to their benefit at the expense of taxpayers' money, which at the end comes and hurts patients. So there's a whole economic business model that is based on data asymmetry.
Mm-hmm.
I know something that you don't know, so if you want it, you have to pay me. So there's no incentive, not only for interoperability, but you can understand that in a country of 330 plus million people, there is room for a lot of different systems to interoperate, but there's a lack of an intercooperability to incentives to actually work together. And so we have a lot of intermediaries. I want to say solutions for non-solutions of problems that we've created. It's almost like creating pills that take care of the side effects of other pills
Yeah.
that from the beginning we should have been taking. So suffice to say, this whole field of benefit managers, pharmacy benefit managers that are supposed to look for best prices for small businesses or for companies. Turns out that it actually increases prices. Same goes for laboratory benefit managers. Same goes for radiology benefit managers. So there's this kind of repetitive business model that is never surprising. And I don't want to single out one because there are many. I think the last one in the news is about Medicare Advantage. Now, as you might know, Medicare is the public program for the elderly in the United States. And Medicare Advantage represents the private initiative to take over or insert themselves in the Medicare program because they want to introduce efficiencies and efficient pricing and give better service. And it turns out, surprise, surprise, that it's exactly the opposite.
Mm-hmm.
That they've been working now for a couple of years. Turns out that they have been now under investigation for hundreds of billions of dollars of misappropriated funds that they took from the government. That the customer service is actually repeatedly in its third or fourth year going down. They do not represent a decrease in cost, but actually an increase in cost. So there's this kind of like pattern that centralization, as is always security vulnerable, it is censorship vulnerable, and it is collusion vulnerable. And that is why there is a movement to, I want to say, resist the introduction of decentralization. Because even if there are efforts for transparency, it never happens because nobody follows up on them. So that's really kind of in a nutshell that decentralization is almost antithetical to the business model of the US healthcare, which is based on centralization and data asymmetry.
Are you struggling with the staffing challenges when it comes to finding the right talent in today's market? What if there was a company out there who helped you streamline your hiring process and give you access to the top relevant talent? The App Solutions Staff Augmentation is a game changer in today's workforce solutions for health tech. Staff augmentation is a process of seamlessly adding skilled professionals to your existing team through a trusted third party. Your team could be extended in under 3 weeks without you spending countless hours on sourcing, pre-screening, and interviews that ultimately lead to nowhere. Why do you want to go the old way when you can simply remove the overhead associated with sourcing, recruiting, training, and retaining talent? Say goodbye to those costly and time-consuming aspects of traditional hiring. You gain access to high-quality talent pool that has been already pre-screened for technical and domain-based knowledge. And on top of that, selected developers are completely aligned with your working hours, communication style, and processes. We get it. You have doubts and have had disappointing experience when it comes to hiring, and the App Solutions understands the importance of trust and customer satisfaction. You can try one of their skilled software engineers for 2 weeks on real tasks and pay if you're satisfied with the work. That's right, you've heard it correctly. If you're interested, hit the link in the description below, mention the CareMinds podcast, and get your sought-after team extension. Save your time and money now. Now let's get back to the episode. And also, given the fact that people are, generally speaking, slower to accept change, even starting thinking about that, do you think that blockchain offers this sort of like verbatim technology implementation of the concepts that might disrupt the industry the way Henry Ford did back in the day with the cars?
I think that's an awesome question because if you take now the patients or the users as a stakeholder, then it's absolutely that. Because in a centralized system that is not designed to actually serve the users, they're not designed to serve the patients as is we say it, but it's not designed to do it. And that's why when people say healthcare is broken, I say, no, it's not broken. It's designed to do exactly what it's doing. So we, as patients, as citizens, as users of health services, we have been accustomed to not know anything, to not be responsible for our behavior, to not be accountable for what we do, to seek health elsewhere. Everything but not in the healthcare system. All this movement of wellness and well-being and aesthetics. So in a sense, what has happened in response to the lack of services and the lack of access and affordability of these services for individuals, we have become healthcare consumers, health service consumers. So we just consume stuff. A pill for every ill, a test for every pest, we do stuff. The idea of prevention, the idea of behavior modification, the ideas of like food as medicine is not even a thing that, I as a physician never talked about. And I'm not going, into the very complex, conversation of the quality of the food in the US and, big agri, big chem, big pharma, because then we're going to really spend all our time talking about it, and it'll sound like some conspiracy theory about Monsanto and what they did to gluten and wheat and soy and corn. And that is like way too expensive. But in general, Americans are health service consumers. Now, what blockchain offers by decentralizing data, by making that data distributed, it's not so much the block. I don't care that data are organized in blocks and they're chained together and they're cryptographically that's less important because there's other ways of doing it. But the fact that it is decentralized and distributed and can be tokenized, which is a fancy way of saying that you can attribute value to data, which can be part of it, all of it, some of it on chain, and that others with permission can look at it. that transforms people from consumers to producers. And so from health consumers, you turn to a health producer. And thanks to tokenization, you turn to a wealth producer. Because there is some, to some extent, a little bit, I want to say in the last 10 years, health production, when they say, oh, you know, if you walk 10,000 steps, you'll get $50. Or, you know, if you eat blueberries, then you might get, you know, some access to a gym at discount.
Yep.
But that is just the beginning. That is nothing compared to the amount of money that is floating in the system. So I don't recall when 23andMe sold my genetic data to GSK that I received a check. I don't recall my insurance company paying me $26,000 because I didn't use opioids this year. So the risk is public, but the gain is private. That's
Yeah.
the business model in the United States.
Mm-hmm.
And blockchain forces that out. It does it by three ways. Two that we already mentioned, which is the decentralization distribution that by proxy kind of like sheds light on all these behind the doors handshakes.
Yeah.
We talked about tokenization, which is attributing value, which could be monetary or non-monetary. It doesn't have to be. It could be a work token. It can give you access, but that voting reputation. It can have other features to it, but you recognize the value that you bring. And then the third, of course, is smart contracts, which is a fancy way of saying that you automate things, that you take away the human nature. You know, the smart contracts are not political or lazy
Yeah.
or depressed or horny or whatever, and decide I'm not going to do this.
Yeah.
And so if you create conditions, if then that, when, you know, then it'll just execute it, and it won't be to the discretion of some person in an insurance company to say, okay, now I want to automate refusals. First is deny, 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 and then we'll start talking, because you just create an onus on the system that corrupts its intention.
Mm-hmm. Yeah, I think what's very important to highlight here is that human relations are extremely important. However, just like we're not rational, and sometimes we use leverages on other people. And like you said, when it comes to smart contracts, that's just rules that being executed automatically. They have no prejudice. They're just being just executed. So essentially, we can think of it as a certain policy being implemented automatically on certain conditions, not more, not less.
Yeah, it's like a vending machine. We decided that a can of Coke costs $1. So you put in $1, you get a can of Coke. You don't put in 50 cents and you get a can of Coke because I'm your friend. Or you put in, $1 and you get 7-Up because you feel like having that instead of Coke. It just does what you did in a transparent and repetitive way. I think that simply the combination of the ability to automate these transactions, which are very heavily regulated and very complex. So now with AI, we can think of polymorphic, smart contracts where they change the conditions during and according to, different conditions, like parametric insurance. This is the insurance you'll get, but if there's going to be a flood or if something unexpected is going to happen, this is what's going to change.
Mm-hmm.
And so I think that the beauty of what blockchain or that culture of decentralization brings into is that everything that we talk about in regard to data can actually be translated to a decentralized system. And so data suddenly becomes an asset for the person that generates it,
Mm-hmm.
not just for the platform in which that data resides. So,
Mm-hmm.
for example, you and I, we're talking now, and we're talking on this platform, and clearly it's adding value to that platform. I'm not getting anything from it. in some sense, I could say that, yeah, my incentive to do this is because I want to make you happy, and then when you're happy, your audience is happy, and the word spreads, and there's some ripple effect. But it's not quantifiable. It's
Hmm.
not containerized. It's not audited. I can't follow up on it. I don't know if the impact was little or large. I
Yeah.
don't know the value of this.
Yeah.
So tokenization of data, this data that now is passing the recording, which is going to be a file, has value.
Yeah.
And maybe now it's worth trash, but one day it'll be worth a lot. I don't know. But it's all in this kind of like cyberspace that we don't know how to attach to it. And it's not serious for a digital economy where everything can be, if not commoditized, at least attached to value. So, if, for example, this recording would have been minted to an NFT, right? It's non fungible because only I spoke at it, and this interaction between us is unique and irreplaceable and undivisible, right? And so, if this would have been in an NFT and maybe put it on an auction, or maybe put it in the market and people would use it asynchronously. And every time in perpetuity, every time someone would click on it just to look at it, I would hear a ping on my phone, which would represent fractions of a cent.
Hmm.
And I'd say, oh, everybody's listening to our podcast. Everybody's listening to the input. Everybody. That is how a digital economy works like. And so in healthcare, you can imagine suddenly that brings an incentive of, yeah, I'm behaving in a certain way. And that has value for me, for my family, for society, and for the stakeholders. And right now, we as patients and users were excluded
Hmm.
from that economic activity. And I'll finish by saying that when I say data is like money, I don't mean monetization of data. There are different ways of monetizing data, which right now is garbage. It's really garbage in, garbage out. It's whatever, whoever decides it. I think my healthcare record is worth $1 million. Zuckerberg thinks that it's worth $1. The current market in the dark web is between $36 and $360. Doesn't matter. But when we use data as an asset,
Hmm.
it has macroeconomic effects because it's putting wage in my hands, and that wage I can use for consumption because that's what capitalism is all about, right? My spend is your income.
Hmm.
But when that goes away, then the capital system stalls. So I'm not presenting that data needs to be self-sovereign or needs to be mined because it's fair. Sure, it's fair too. And what's going on right now is not fair. But also it's a better economic model. It is more sustainable because, to use capitalism, terminology, it increases the pie and includes everyone in that economic activity.
This is extremely insightful, and I'm so glad to have you here and have this platform to at least share these thoughts because changes start with them. And speaking about changes, Impact Rooms
Hmm.
is an ecosystem that explores these Web3 opportunities for emerging countries. Can you please talk about your experience with that and if you think that emerging markets have a different view and understanding of implementation of Web3 technologies given their past, given their current uh, conditions, that they see more value and more potential in the change and they're willing to, I don't know, go extra hard or understand or embrace the technology in a way that would allow for positive change that other people, other countries, other societies could perceive and start shifting their thinking towards, hey, maybe we should try something that is similar to this because of the impact that that solution made.
Yeah, I appreciate it, and thank you for asking about impact rooms. Impact rooms is a journey that I have with my co-fellows, co-founders, and co-partners in it. It's a matching engine, if you wish, an ecosystem that connects startup and early stage companies with either markets, service providers, as well as capital. And it came out of a necessity when I started working in Africa, where there was no information, no available or accessible information to do that type of matching. Someone would say, where can I find an interesting healthcare company that solves X? Or I have $1,000 and I would like to invest it in malaria research. Where would I send it
Mm-hmm.
to?
Mm-hmm.
So again, this data paucity that I mentioned before. Um, I think that there's a huge difference between obese economies and lean economies, like in Africa or Latin America, or to large parts of uh, uh, um, Asia. And just to give you a sense, I think that out of the 8 billion people that are out in the world, I want to
Mm-hmm.
say that 1 billion are in obese economies and the other 7 are in lean economies. So this is very relevant. So maybe our audience is now sitting in a very comfortable place, or maybe they are, a digital nomad in one of those lean economies, but they're actually in a very comfy place
Mm-hmm.
in that, country. But it is relevant because you cannot really talk about mental health and physical health and planet health without talking about financial health. And so, what Impact Rooms offers that is a little bit different than any AI that matches whatever gestalt input comes in and all that is really to your point about community. And I got a lot of flack back, I think it was in 2021, when I dared say that Africa is doing way better with COVID than the US. It was like unfathomable because, we're so special and, we cannot decentralize ourselves from our post colonial mind and actually imagine that other people can do things better. And so when people would say to me, well, how is that? I said, it's very simple. First of all, the COVID is not their first pandemic. They have Zika, Ebola, they had, yellow fever, all kinds of dengue, all kinds of, so it's not their first,
Mm-hmm.
infectious disease catastrophe.
Mm-hmm.
And so the Africa CDC is a very robust environment. The second is that Africans in general, appreciate, I want to say, policies that pertain to public health.
Mm-hmm.
When people say in an airborne disease, put a mask, and nobody's saying I'm going to now fulfill my constitutional right to cough on you, or fulfill my constitutional right to be stupid and do whatever I want because that's what it's called to be freedom.
Mm-hmm.
And argue things that simply other people in the world are looking at. Why are they arguing about this? And so they very quickly, assumed different types of I want to say public health policies. And again, you can't speak of Africa as a whole. There are 54 countries that have different levels of literacy and GDP and health literacy and infrastructure, but more or less they abided, what the WHO recommended. And the third, which I think is the most important, is that they're young. 70% of Africa is less than 30. Their median age is 19. So when I go to Africa, they look at me and say, man, you are so old. It's like, what? And I say, how old are you? I say, well, I'm 39 with 20 years of experience. And I'm like,
Yeah.
oh my God, it's so old. And so we are in a country which is old and has lots of comorbidities, and they're young and they just go through it. And so I got a huge flack of realizing that there are countries that have so much less than what we have. But health wise, in terms of prevention, in terms of nutrition, in terms of life expectancy, are doing better than us. And we don't have time to go into all these examples that, you know, a black woman in East Texas is 4 times at risk to die after childbirth than a woman, for example, in Senegal.
Mm-hmm.
When people say, well, we're the best, you know, best healthcare system, I say, yeah, best healthcare system for you.
Mm-hmm.
Every healthcare system is good for you. And I want to say that in Africa, I was very surprised to see a robust healthcare system that obviously needs, you know, investment in secondary and tertiary care. But in terms of their, I would call them blockchain intuits. You know, they're like intuitively, they understand that none of us is as good as all of us. They understand the power of a community. They understand that we have to work together and coordinate and cooperate if we want this to succeed. And there's a very interesting book called Weird or something like that, Weird People, where Weird stands for Western, educated, industrialized, rich democracies, where there is this emphasis of individualism, the emphasis of being right all the time, the emphasis of winning at all costs, the emphasis of how special I am at the expense of recognizing the importance of the community. And you're only good because your fellow community thinks that you're good. And that is why talking about things like DAO, like liquidity pools, like I want to say a decentralized community represents a lot of what already they have in analog, and it just needs to be digitized. And in fact, in terms of digitization, they have better mobile penetration than we do. They've been using electronic or mobile money way before we have. In New York City, only recently, suddenly I'm seeing, you know, waiters coming to the table with a machine where you can pay a credit card, which has been done in Europe for 20 years and in Africa for 15. So I think that we really need to open our eyes and see what other people are doing and appreciate that.
Very interesting. And Alex, what would be your words of encouragement for people that are looking to start shifting their thinking and understand that with the modern plethora of problems in today's challenging times, there has to be some shift in thinking. There has to be some shift in the understanding of the responsibility.
Yeah, I want to say that I don't know if I would call it the good news, but the reality is that everybody, for whatever reason, says this, whatever this is not working. So there are very few people, maybe those who belong to the 147 families that own 70% of the assets of the planet. You know, besides them, I don't think that many people, including our audience, are saying this is working great, don't change a thing. So I think that now we're just moving from a pre-contemplative phase where everything's fine, the American dream is fine, capitalism in all shapes and form cannot be disputed, techno-feudalism is not a thing, centralization has no consequences, capital externalities with pollution doesn't mean anything. I think that now we're kind of like, thanks to your generation, is saying, wait a second, this is not working for me. And so we're moving into the contemplative phase of, okay, we need to think about this. Now, this is where we diverge. You know, there are people that are invested in this current model. So it's clear that they are not very incentivized to change because they're benefiting from it. If I'm a person who makes money from collecting plastic garbage or plastic waste, I don't want people to stop throwing
Yes.
plastic. So there's a lot that are all these intermediaries, all these brokers, all these, people that are benefiting from the solutions of non-solutions of problems. But then there is, a large cohort of people that are thinking about all this. And I think that in order to come up with interesting and viable solutions, you need to be three things. One is you need to be curious. And it's hard. It's hard in a world where there's such an abundance of information and misinformation. It is head spinning. I don't know what to believe. And with generative AI, it's going to be just even harder.
Mm-hmm.
So you have to be curious. But then the second thing is what we say in the crypto world, DYOR, right? Do your own research. Cannot take anything now at face value. Every single statement that I see or hear, I have to triangulate immediately. And so that is tough. That is a new way of doing things. One might argue a better way. Maybe I should have done it before. Maybe if I would have done my research before, we wouldn't be in a lot of the trouble that we are right now. But definitely now with the abundance of unverified data, which by the way would be solved if we would see its provenance and we would see the on-chain activity. So we have that.
Mm-hmm.
And the third is to be original, to really think about original things. That I come from a generation that was taught about, think global and act local. So here's the problem of, food hunger. And this is what I think the solution is. And then you come locally to the ground and they say, no, this is irrelevant to us.
Mm-hmm.
You're talking to us about, wheat and rice, but all what we have is cassava. So don't just so instead what we have to do is to think local and act global. In other words, that each community understands its problems best and comes up with solutions. And maybe thanks to those solutions, now they can scale and go somewhere. So we have to be, for example, ready that in the United States, there might be some piece of software that was developed in Nairobi or in Kigali or in Accra or in Abidjan that can be used in New York City, and not assume that just because it's made in Africa, it's worthless or it's not useful. And for that, the direct answer to your question is we need to be ready. And when I say ready, ready means two things, right? You need to be ready as be prepared. That's the curiosity, the do your own research. But also ready means willing. Are you willing? Is there any will? Is there any poise to want to change?
Yeah.
And that's really, we need to be ready. And I think that these are very good times in the sense of we understand that things have to change, but they're very perilous because we might come up with very powerful solutions, like, for example, AI. But if we apply on AI the same centralization, late stage capitalism, techno feudalic approach,
Yeah. Yeah.
that will be the demise of our planet. So it's not the technology itself, it's what people are doing with that technology that makes the difference.
Yeah. Couldn't agree more. Alex, I've enjoyed this conversation a lot. Thank you very much for being a part of this.
Thank you. Thank you so much. And looking forward to talking to you again.
Thank you very much for watching this CareMinds podcast with Alex Cahana, a medical doctor and a venture partner at Impact Rooms. If you enjoyed this episode, please consider giving it a like, a subscription, and we would appreciate this a lot. This would actually help the channel to produce more content like this. And I'll talk to you soon. Until next time.